Alright, let's start talking about a CT abdomen and pelvis and go through this together. So this will take a little while, but I want to work through this because what you will likely see on board exams and other places is a CT slice, and then they're going to ask you either what the structure is or something related to the structure. So let's go through how to read a CT of the abdomen and pelvis. So if we look at a CT abdomen and pelvis, keep in mind that you're looking basically as if you were standing at the feet of the patient with them lying on their back. So this side is going to be the patient's left. This side will be the patient's right. Okay, so again, just like if you were standing at the foot of the table and looking up the patient. And then this is the top of the CT of the abdomen and pelvis. How do I know that it's the very top of that scan? What do I see on the screen? I see a heart and I see lungs, all this black. Air shows up as black on normal X-ray and CT. So that's air, which means that this is at the bottom of the lungs because the base of the heart being here. A couple other things to note is that this CT scan has IV contrast. And how do I know that? If you look at the heart, you can actually see the chambers defined pretty well, and they're nice and bright white, and that's because there's IV contrast in there. So IV, it's intravenous, it's going to go through the circulatory system, so everything vascular should light up. Alright, so that heart's really nice bright white. Okay, what other structures do we see that we can go ahead and comment on before we start getting some lines on here to look at and try to figure out what it is? Well, one is I've got a structure right here that is right in front of the vertebrae, and it's nice and circular, it's completely circular, what structure might that be? So that's the aorta. So we're at the base of the lungs, base of the heart, and that's the descending aorta coming through the diaphragm and abdomen. And again, you can see right there is where the diaphragm is, through the diaphragm, so to speak. Okay, these bright white things here, those are ribs. Okay, we're cutting through sections of ribs there. So here's some structures that are labeled. So what do we have here? Well, A, you can look at right here. So if that's the patient's right side, keep in mind, right and left. That's the patient's right side, and it's right at the base of the heart. It's right where the lungs are. What is that? It's at the top of the diaphragm, and the liver is starting to come in view. And the liver is right up against the diaphragm. Okay, so that's the liver. B, what is B? It's the structure that's in front of the aorta, behind the heart, basically right in the middle of the chest and coming down the middle of the abdomen, and it's not completely circular, it's not completely round, it's a little ovoid. So what could that be? Again, here's the aorta, right? So there's aorta. This is in front of the aorta. Not quite circular, behind the heart. Esophagus. So that's esophagus coming down. And then C is simply pointing at the ribs where they have their junctions with the vertebrae, so costovertebral junctions. So, as we noted there. Alright, we're going to keep going down this scan, and basically what we're doing is scanning from the top of the abdomen to the bottom of the pelvis. So as we keep going from slide to slide, it's going to keep progressing more distal, more caudate, if you will. So again, what structures do we have here? We'll take a note at some of the lines that pop up in the view. So what do you think B is, first off? That's the aorta, right? It's nice and circular right in front of the vertebrae. And then again, here we see the esophagus too, which I'm drawing an arrow on. So there's the esophagus again. And in A and D, what is A and D looking at? They are nice and round. They have contrast in them, so they're probably vascular. And they're right behind the aorta on top of the vertebrae. And there's two of them, one on the right, one on the left. So that's your azygos vein and your hemiazygos vein, okay? Now C, what is C at? Well, if we got liver, we know that, right? So we keep on scanning down. Here's liver, okay? Just to look on the left side really quick, what is this structure right here? I got a lot of white stuff through here. And that's oral contrast. Notice the bright white color to it. It's right below the diaphragm on the left side. It has a bunch of oral contrast in it. That's your stomach. Okay? So we got esophagus, stomach, we got aorta, we got the azygos and hemiazygos veins. The liver, and then C is actually really round as well. That's the vessel. That's your inferior vena cava coming up by the liver. Okay? Alright, so again, keep on rolling down the abdomen a little bit more. What do we see here? What's A pointing at? I said it before, these are slices of the ribs. Right? We got lots of white stuff here. That's stomach. And we actually see the spleen starting to come into view as well, which is this structure right here, right? So spleen's on the left, liver is on the right. C is a vertebrae, of course, and then B is simply pointing at anatomy, the cardiac region of the stomach. Okay? So A and B here. Also, we're still looking at some structures. There's a thoracic duct that comes through, and then you got the gastroesophageal junction. Looking here, this is simply as structures. You got the lesser and greater curvatures of the stomach and the cardiac region. So lesser curvature of the stomach, you got the cardiac region of the stomach, and the greater curvature, which is on the outside of the stomach. Okay. And of course, again, you're seeing the spleen more and more as we go a little bit more inferior. Here's the aorta again. Here's that azygos vein, hemiazygos vein. Coming on down, what structures are we pointing at now? A and B are pointing at the liver, if you guessed that, that's correct. But more specifically, they're pointing at a little bit of white stuff in there, which are ducts. And then there's contrast in the stomach, of course. So you've got the right hepatic vein, actually, and the left hepatic vein that are popping up there. And there's also some intrahepatic ducts that run through as well. It's really hard to see on this scan. Not something I don't think you would be asked to pick out. If you look, you do have the crew of the diaphragm here. You can see that well defined. The aorta again, azygos and hemiazygos veins, and of course the spleen coming into better view as time goes on. And then the stomach right through there, all the way around. So, all right. On down, structure A and B, of course we already said. You got the body region of the stomach there, and then you got the spleen. Alright, what are we looking at A? So you've noticed that the liver has divided now, so we actually are seeing some lobes to some degree, right? So, and this is right between these two lobes. So you have the round ligament of the liver. Alright, structure A and B. So what is B pointing at? Simply pointing at that black structure. What is that? That's still the base of the lungs. So that's just the inferior portion of the lungs in the very posterior aspect. Remember, the lungs come down farther in the posterior part of the chest wall. What's A pointing at? That's a big, nice, round structure, right? It goes right up by the liver. And the aorta is right here, right? And again, there's the hemiazygos vein, and then here's the azygos vein. So what is this? Correct, inferior vena cava, right? Coming on down, what do we have here? So we got the quadrate lobe of the liver, left lobe of the liver, and then the other arrow is pointing at the median arcuate. Some structures noted here. What are we looking at? Well, let's go on the left side of the body for a minute. So F. It's looking at some tubular structures, it looks like, right? So is E. So you've got a tubular structure here that is right at the body of the stomach, right at the cardiac region of the stomach. What could that be? D. We look at that. What do we have? Well, we have a structure that is like this. It's on the left side. It's near the spleen and stomach. There's air in here. We know that because of the black stuff. And then there's different variations of color in here. Some very solid, some not so solid. That's bowel, and we'll talk about it in a second. C is air. That's just the stomach itself. And then B and A, you've got some tubular structures as well, right? Just to define those out really quick. So there's air in the stomach. You got your splenic flexure there, and more specifically, we'll see in a minute, this is also at the splenic flexure. What do you have in terms of colon? The descending colon starts there, right? And transverse the opposite direction. Left gastric artery. You got your short gastric arteries. You got your cystic duct. And then this is the right adrenal gland. How do we know that? We'll see even more so in the next slide. But we're not to the level of the kidney yet. We still have spleen. Still have liver. We don't have any kidneys yet, which should sit in these areas. But it's before the kidney, or rather on top of the kidney. It's your right adrenal gland. Alright, structures noted again. What do we look at? You got your left suprarenal gland. So there's that. Also known, of course, as the adrenal gland. It's on top of the kidney because we're not quite to the kidney yet. They did define some anatomy structures. There's the linea alba. You got rectus abdominis muscles connected by the linea alba, and your portal vein, which is right here, right? What's this structure here? That should be your inferior vena cava. This one, aorta, a hemizygous vein, azygous vein. Okay. Actually, here's splenic artery. Name those structures. So A, what do we have with A? Well, it's slightly darkened in, and it sits right up against the bottom of the liver, and it's kind of tubular structure. If you're thinking gallbladder, you would be correct. What do we see with B and C? Simply pointing out some arteries here, right? And then D, so we got the gallbladder, we got the common hepatic artery, you got your splenic artery running across the course from here. It dives through a different slice of CT there and then up to the spleen. And then there's your celiac trunk that those are coming off of, which is pretty cool. All right, what do we have here? So just to note again, what's this? Gallbladder, right? Bottom of the liver. Real nice tubular structure. It usually shows up dark unless it has stones in it, and then you'll actually see some white stones pop in. Okay. You've still got your stomach here. What's this structure D? Starts over near the liver, and it's a little odd shape, and it runs toward the spleen. That would be your pancreas, right? A and E, you got your crew of the diaphragm. So next, so you got the pylorus of the stomach highlighted here. You got the first part of the duodenum starting here. You got the right crew and left crew of the diaphragm. And there's your body of the pancreas, as we noted before. Again, gallbladder here. You can actually see, what do you see coming into view right here? Well, we keep scanning down lower, right? And we saw an adrenal gland earlier. If we're below the adrenal gland, that is your right kidney. Okay? Left kidney is not in view yet because left kidney sits a little bit lower than the right kidney. So we'll get to that in a minute. Again, a note, here's your splenic artery running across. Okay? Alright, A and D. You got your second part of the duodenum, so you can just note that there's small bowel running through here, and you got your duodenum running. Also, here's your descending colon, as we already noted before, with the splenic flexure, and then you're coming down, descending. Kidneys coming into view a little bit more as we go. Inferior vena cava sitting there, you got aorta sitting there. Splenic artery running across, and then you got your pancreas here. And again, gallbladder here. Okay. What are we pointing out with A and B? Well, that's the pancreas, so it better be the pancreatic head and the pancreatic tail. And there you go. And then C, as it was, is a superior mesenteric artery. So, all right, A, what was that again? And you're starting to see a little bit on the left side now. That would be your right kidney and your left kidney. All right. And then what about B and C? So there's your right kidney, renal cortex. You got the duodenum jejunal flexure, which you wouldn't expect you to be able to point out exactly where that is. That's what that is, the erector spinae muscle. Coming on down, what's A and B? Well, A is this. So you see a lot of air in that, the black stuff. You see different densities of solid stuff in there. So you might think that might be stool. You would be correct. And if it's right below the liver, which you can see the very inferior aspect of the liver, what might it be? We're probably at the hepatic flexure. That would be ascending colon going into transverse colon soon. All right. And then B is your jejunal artery. Okay. Oops, skipped a little ahead, but there's your right kidney, your left kidney. And then you actually have your left renal vein, right? So this structure is your inferior vena cava, and you have your left renal artery, which is coursing across, left renal vein coursing across into the inferior vena cava. And then A would be what? B. So your right renal vein, which is dumping into the inferior vena cava, and then your ascending colon, because we're getting lower and lower on that side, but this is all stool. And you can kind of tell this is colon for a couple of reasons versus small bowel, which is over here. Why is that? One is colon's job, especially, is to take out all the water it can. So you're going to have really dry stool compared to other areas. So it's going to have a different density. It's not going to be completely solid. It's not going to be completely full of water. And also it's going to be less contrast because all the contrast hasn't necessarily made it to the colon yet as it's working its way through the gut. All right, you can see the very end of the spleen there. Okay. All right, so again, right kidney, right renal vein. How do I know that? Because it's connected up to the inferior vena cava right here. Okay, or to here. Left kidney there, of course, and again, there's that stool that looks really dried out, so to speak. That would be the ascending colon. All right, structures here. So you got the right renal vein and left renal artery. Why is one vein and one's artery? Well, if you look at the right renal vein structure, that's connecting up to the inferior vena cava. You've got a vessel on the left side, but where's it connecting to? Not the IVC. It's connecting up to the aorta. It's connecting up to that. It's an artery. So that's your left renal artery. As you get on down through here, you see more and more bowel. You got your transverse colon going. You got your left renal vein. You can't see on this slice that it's connected up to the IVC. So it would be hard to know for sure on that slice if it is a vein or artery. Okay. So kidneys are in more and more view here, which is great. Again, that's the left renal vein in this case. You've got iliocolic artery coming off the superior mesenteric artery. You got the showing up. Again, this is colon because it's got all the dried out stool, so to speak. So there's your transverse colon, and then here's your ascending colon still. What is A? What do you think? So it's inside the kidney there. It's not vascular structure because it's not lit up white. So there's your renal pelvis. All right, what do you think A and B are? So you've got your inferior vena cava and your abdominal aorta, almost side by side at this point. Okay. Coming on down, some structure. You got descending colon still. You've still got the transverse colon showing up as well. All right. There's your muscles, the psoas major and quadratus lumborum. Here's some muscle structures as well. So you've got the internal oblique, the transversus abdominis, or internal oblique, and the external oblique. You got structure A here. It's got really dried out looking stools, so to speak. That would be your ascending colon. All right, A, this is bright white. If you look at it, it looks very much like this as well, like this, like this, like this. It's kind of solid looking and bright, therefore it's contrast. And it doesn't look dried out nor less contrast like that does. It is still, what is that? That's your ilium, so small bowel. Okay, transverse colon still. Keep coming down. Lots of gut, lots of bowel. Here's your superior mesenteric artery, your inferior mesenteric artery sitting right next to the aorta. Okay, so B is vertebrae. What do you think A is? Aortic bifurcation. The aorta still, but let's watch it as we go down a little bit more. We happen to be at the L4 vertebral level, as noted here. And I know I'm down in the pelvis because I'm seeing only bowel basically at the moment. And here's my colon for sure because it's dried out bowel versus all this nice solid white contrast bowel. I don't see any kidneys, I don't have a liver, I don't have a spleen, I don't have any ribs showing up. I'm seeing muscles that are consistent with the pelvic area as well. So there's the aortic bifurcation, but let's watch as we go. You see what happens. Now we have linea alba noted again. You got your median sacral artery, which is not that important to look at on here. And in your common iliac artery. All right, there's your cecum, and off of that would be your appendix, which is probably this sitting right here, tubular structure coming off of that. You got inferior epigastric artery, sacroiliac joint or SI joint. There's your sacrum coming in the good view here. And iliac. You got internal iliac artery, external iliac artery, and there's a superior gluteal artery. Again, I don't expect that board exams are going to hit on these very much. Maybe I'm wrong. Maybe they do. Here's muscles that are good as well. So you got your iliacus muscle right inside the ilium. You got your gluteus minimus, which is the most internal muscle out here. You got your gluteus medius and your gluteus maximus, which is far out. All right, A, what are we pointing at here? Well, I see a lot of stool here that looks kind of dry, and we're down at the sacral level, so think about what that might be. It is, in fact, the sigmoid colon. All right, we've come across from the descending colon. Now we're getting near the rectum, and that's the sigmoid colon, as it does its S shape, essentially, as it comes down. And then you got your piriformis muscle coming across there. Again, here's the sigmoid colon coming across the rectum, so it's got that almost S shape to it coming down from the descending colon. In B, you got some structures there, the iliopsoas, tensor fascia latae. You got the rectum now, and we're actually down below where most of the sigmoid is at the moment. Body, the ilium, and then the sacrum at the very inferior part of it, essentially. Keep an eye on this structure. What do you think this structure might be? We're down in the pelvis for sure. Now this is, again, the rectum, right? All right, so keep following that structure right there. See what you think about that. Again, rectum right there. All right, seminal vesicle, obturator internus, sartorius, tensor fascia latae again. Not structures I'm not worried about. Now we get to identify the one I've been wanting you to keep an eye on. It's down in the pelvis, and it's right in front of where the rectum is. Here's the rectum. What do you think it is? If you said bladder, you'd be correct. So that's the urinary bladder sitting right in front of the rectum. All right. So A, what do you think that is? This is the iliac, if you've been watching. So what's this? Better be a femur. So you got your head or your femur there. All right. Acetabular fossa. You got ischial-anal fossa. And then femoral artery prostate gland, which is important here. So it's below the bladder, as you noted. And then that's the prostate. It's that walnut-shaped structure. It does have the two lobes posteriorly that you're filling on exam when you do the rectal exam. There's a rectum. Okay. Rectus femoralis, ischium, and that's it. So here's some references if you want to look at some walk through the CT abdomen and pelvis as well. And hopefully this has given you some idea of orientation and what to look for when you're going through some of the board questions for CT on the abdomen and pelvis.